Ladies and gentlemen, dear colleagues, it's a great pleasure and honor for me to welcome you here in Vienna again at the ESPEN Congress and at this symposium organized by Nestle with the title Regain Autonomy in the Malnourished Older Adult, There's No Time to Lose. As you heard, I'm doctor for internal medicine and I'm working in a department which has also acute geriatric care. So in that aspect, I know that nutritional care for elderly and older people and patients is very essential. So it's a big pleasure for me to have a symposium with top experts from Europe concerning that scientific field, and I'm really looking forward to the lectures, and I'm very happy that some of those experts I know personally since years because we've worked together in former times. The societies are becoming older, the populations are aging, and the part of persons over the age of 65 is growing very fast. It's interesting that on that slide here you see the global numbers, but if you look to Europe, especially Western Europe, you know that the so-called baby boomer generation, this means persons who are born between 1960 and 1965, before the anti-baby bill has come to the market, is the largest group of people in the society. So in Austria and in other European countries, I think it will be not 16%, 2050 it will be more than 30% of people living there who are at the age of over 65. And it's good luck that also in other continents the life expectancy is increasing, especially in the African countries. I've read a couple of weeks ago, life expectancy has increased by about 10 years on the average during the last 15 or 20 years, I think. So we have an aging society, which is good because it means we have good social environment and we have medical supply where nutritional care is an important part of that. And not only the proportion of people over 65 will increase, but especially those who are very old and who are the oldest in our society, and especially in that group, nutritional problems emerge in a very high percentage. That means if you look to physiology, it's clear that with aging there's some decline in the changes in the functional performance of our different organ system. It's not the same in every individual, as you know, so we have no standard aged organ, but in the mean you have to observe a decline. We have reduced resilience to physical, cognitive and mental stressors from outside. That means rehabilitation becomes harder, or to regain weight and muscle substance after you have lost it. And we have reduced adaptive and regenerative capacity in all. To have a long well-being in life depends on different factors. It's clear that also the genes play a very important role, because if you have long-living families with some protective genes in their body, they have more and better chances to become old in good health than other families who have not the luck to have those genes. But it's also environment and it's lifestyle which has a big impact on our health and also on successful aging, as it is called nowadays. And successful aging begins even in pregnancy in the body of the mother, because here the fetus is already determined maybe by epigenetic alterations what his metabolism in later life is concerned. And as you know, obesity in young age is also associated with, for example, cognitive impairment in middle and higher ages, though there is much in between those cycles we see on the picture, and we focus now on the older person who has a high risk to have disease-related weight loss loss of muscle mass, muscle strength, and then loss of autonomy, because if the muscle doesn't work anymore, first part is frailty and then it's dependency on nursing. That means, all in all, there's no time to lose. This means we have to try to promote healthy living, including healthy nutrition, from the first day in life and even before to high age. And on focus on high age, we want to present new data and important data on malnourished older adults and those who are at risk for that. And for that purpose, we have 4 excellent speakers who will give us each a talk. So we have 4 talks in the next 1.5 hours. The first is nutritional facts and functional decline in older people, what we know, what we ignore. This is the basis. Then appetite and weight loss data from a new ICOP WHO program in France. Costs and cost savings, this means economic aspects of optimal nutrition, intervention and care in disease-related malnutrition. Energy and protein, nutrient-dense intervention and compliance as key factors of recovery in patients with malnutrition. The persons who will give out the talks are first Professor Rodriguez Manas. He's a doyen in the malnutrition in old life. He's geriatrician at the Hospital University of Madrid, and he has organized a lot of international, especially European multi-center studies which were funded by the EU or by other institutions. He has published, yesterday he told me, almost 400 chapters in peer-reviewed journals and books, so he's a great scientist and also a clinician. Then we have Professor Maria Eugenia Soto-Martin. I had French school for 4 years, but it's not much lost anymore. She is working at the Alzheimer's Clinical and Research Center in Toulouse University in France, and she is also in focus on cognitive impairment and on the interdependency with nutrition, and she worked together with also another great geriatrician, Professor Bruno Velas. Then comes Dr. Karin Fryer. She's from the Netherlands. She lives and works in Maastricht and works at the University of Maastricht, and there's a special focus on health economics in concern with nutritional care and with outcome research. She has also a focus on treatment of obesity, prevention of obesity, but also treatment and prevention of malnutrition in old age. And the last speaker is Professor Dr. Agathe Renaud-Simon. She's also French, comes directly from Paris, from a university clinic there, Paris City University, is professor for gerontology and geriatrics, and works in 3 hospitals which belong to a hospital group with a focus on geriatric care. She's also a prominent member of ESPEN and a worker in the working group for ESPEN guidelines on clinical nutrition and hydration geriatrics. And as you know, this is already outdated because the last update was not 2019 but 2022. So we have even a new manuscript, a new publication. I read it already, which is even better than the former. She has also published 80 papers in peer-reviewed journal. So I'm looking forward to a very interesting symposium, and Professor Rodriguez Manas, please come to the podium and give us your lecture. Thanks a lot.